As an example, you don't hear anymore about ventilators. What happened to the ventilators? And now they're giving you the other. It's called testing. But they don't want to use all of the capacity that we've created. We have tremendous capacity. Dr. Birx will be explaining that. They know that. The governors know that. The Democrat governors know that. They're the ones that are complaining. Lawmakers must stop blocking these funds and replenish the program without delay. The Democrats have to come on board. I used to read that these were Democrat programs, not Republican. Seems to have switched around a lot, hasn't it, huh? Switched around a lot. The Republicans want it. I think the Democrats probably do too. But they also want other things that are unacceptable. This is about COVID. This is about the plague and what it's done to us. This isn't about extraneous things that they've been trying to get for years and that our country doesn't want them to have. What we've done is incredible in testing, and I started with an obsolete, broken system from a previous administration or administrations. But I would really say administration for a different reason, because testing has become so advanced over the last number of years. And we have the most advanced of all. I spoke with other nations this morning, the leaders, and they all are talking about our great testing capability, and some of them want to know what to do. Our testing is getting better and better. I took the first test. The first test was not pleasant. This was not a pleasant thing. I said, "You got to be kidding," to the doctor. "You got to be kidding." Up your nose, and then we hang a right, and it goes down here, and then we'll wiggle it around here under your eye, and then we'll pull it out, and we'll say, I said, "No, there's no way that can happen." "Is that the way it goes? You sure?" This was a very unpleasant test. And then I was tested a few weeks later with the new test that just came out, the Abbott, where they just touch your nose, basically, and they put it in a machine, and literally a few minutes later, they tell you if you're fine. And I was lucky in both cases. So we have done a job that nobody believed. This was a military and private enterprises march. We marched. And unfortunately, with the other side, because they're viewing it as an election. How did President Trump do? Oh, he did terribly. Let's see. He did terribly. Oh, but we just got them the ventilators that they didn't have that they should have had. We just got them hospital beds by the thousands. We just got them testing that they don't even know how to use. In some cases, they have machines that they're only using 5% and 10% of the machine because they have an advanced machine and they don't know how to use it. It can do much more. So we've had people explain how to use it. So I don't know. I don't think I'd do that on the other side. I really don't. I think that here we have a crisis and we have to work together, and I hope we're going to work together. But we're moving along, and we're moving along well. We're moving along well. This should not be a partisan witch hunt, like the Russia witch hunt that turned out to be a total phony deal. Unfortunately, some of these voices, though, are attempting to bring this into politics, and whether it's testing or ventilators or hospital beds or other dimensions of our sweeping public health response. And we started with garbage. As our expert said yesterday, America's testing capability and capacity is fully sufficient to begin opening up the country totally. Indeed, our system is by far the most robust and advanced anywhere in the world, by far. The rest of the world will tell you. He's a gentleman, Mike Pence, a real gentleman. And the Democrat senators requested a phone call with him yesterday. And I think they had, for the most part, all of them on, like approximately 47. I heard it was just about all of them, whatever it might be. I don't want to be wrong by 1 or 2 or 10 and have the press say, he lied, he told a lie. Terrible, terrible. Whatever it was, but they have 47, and I guess most of them were on. I heard they were so rude. I used the term today. I said rude and nasty, but I heard they were so rude no matter what he said, which was all very positive in terms of winning this battle against the invisible enemy, no matter what he said, they were fresh, they were nasty, and it was, I heard, just a terrible thing. And I said, Mike, that's politics. That's what it is. If we came into this room today and said, the battle is over, we have won, it's 100% gone, the Democrats would say the president has done a horrible job. He has done a disgraceful job. It is a shame how bad he is. You know, this is the talking points. This is political, and it would be nice not to have that, especially when we've done the job we've done. The media's been some very honest, but some very dishonest. You know that. You know that. I mean, I even read a story where Mark Meadows was a tough guy. He was crying. He was crying. There was Maggie Haberman. You know, she won a Pulitzer Prize for her coverage of Russia, but she was wrong in Russia. So was everyone else. They should all give back their Pulitzer Prizes. In fact, it turned out that the crime was committed by the other side. The crime was not committed by this side. It was committed by the other side, a bunch of bad people. You saw the reports coming out over the last 2 weeks. They got caught. So Maggie Haberman gets a Pulitzer Prize. She's a third-rate reporter, New York Times. And we put her name up here last week. You saw that. People thought it was a commercial. It wasn't a commercial. It's like a commercial, but it wasn't a commercial. It was just clips. And because we exposed her as being a bad reporter, what happened is she came out and said, Mark Meadows was crying, and they made it sound, I said, Mark, and it's okay if he did, I wouldn't, you know, look. But I think he was crying probably really for the wrong reason they had it down. But he's not a crier. And if he was, I've known criers. I could tell you people that you know that are very famous, they cry, and that's okay too. But it was a nasty story in so many ways. It was fake news. And she only did it because we exposed her for being a terrible, dishonest reporter. She is. I've known her for a long while. I haven't spoken to her a long time. I made the mistake. I take a picture with her at the desk a long time ago. Every time she does a story, if I say, I haven't spoken to her in many, many, many months, maybe years. I don't speak to her. She's fake. A lot of people are fake. A lot of people, we get a lot of fake people. But what happens is she writes this story as retribution, puts it in the New York Times, and the New York Times is a very dishonest newspaper. It's my opinion. It's not an opinion. It's actually, from my standpoint, you know, the very hard thing to figure, though, most people wouldn't know that, but I know because I know the facts. And they make up, I said it today, they make up words. Sources say, most often used, sources say. You know what sources say mean? Sources say means they have nobody, and they make it up, okay? And they have a few other type statements that mean the same thing. But sources say is the most often used expression in the Washington Post, New York Times especially, CNN, fake news, CNN. They should really be mandated, and I mean mandated, to use a name. If there's a source, use a name. Say that Kayleigh McEnany said, or somebody. And you'd find out that the, number one, the source wouldn't say it. The sources don't exist. I don't believe the sources exist. And I try and tell this, you know, the beautiful thing about doing these conferences is that we have tremendous numbers of viewers, and I'm able to reach the viewers without having to go through fake news where they make a good story into a bad story. So with all of that, it's been an incredible period of time. We've done a fantastic job with the talk of other nations. The leaders of other nations are calling us for help. They're calling us for equipment. They're calling us for testing capacities. Now, with the testing, we are going further. Deborah's going to talk about that now. With the testing, we have some other tests coming up that are going to be, I think, phenomenal. I think they're going to blow away everything as soon as they come out. And we're going to get them out as soon as possible. But I'd like to ask Dr. Birx to come up and say a few words about where we've come, how far we've come, and more importantly, where we're going from this point. Because honestly, it's quite amazing. Thank you very much.
Thank you, Mr. President. If we could have the first slide, I wanted to give you an update on where we are as states and as counties and as cities. I know you all are watching carefully. The numbers have shifted over the last few days. What happens when when states change the reporting from confirmed to probable, so now all probable cases are included. They had to add them back in. Even though the cases may have been from March, they were added over 14th, 15th, and 16th of April, and states may continue to be adding them. Eventually, we're hoping that those get accounted for on the day when the presumptive cases or the probable cases were counted, but right now they're added in one fell swoop. So this is New York and New Jersey, and I think we all know how difficult and what a difficult time both New York and New Jersey have had. I call your attention to the axis. It goes up to 250,000 cases, so you can get a frame of how we're talking about some of the other metro areas. Next slide. These are the 25 metro areas, the top 25 metro areas, and you can only see the New York metro area in this slide. Again, the axis goes up to about 300,000. It includes the New Jersey part of the metro area as well as part of southern Connecticut. Next slide. But if I take New York out, and the reason I wanted to do that, now the axis is 1/10 of the previous axis. So that previous axis, the previous slide, 300,000. This slide, 30,000. So that will give you a frame of reference for some of these other metros. The reason I wanted to show you this is cumulative cases, and we are still tracking very closely the issues in Chicago and Boston. But on this slide, I hope you can see the yellow line. That is Detroit. And Detroit, and this mayor of Detroit has really done an extraordinary job, and the people of Detroit have done an extraordinary job with their social distancing. The other line I want to call your attention to is the line here. This is New Orleans. And I think, frankly, I was concerned about New Orleans because they had a lot of pre-existing comorbidities. They have 2 or 3 major hospitals, but cover a very large area, a geographic area. And that other blue line that you can see that's down right here, that's the Seattle line. And you can see that their response, because of the nursing home alert, they were one of the first states and the first metro areas to really move to social distancing. And so they've really never had a peak like many of the other metros. Next slide. Then I just want to take you through some of these new case graphics. That was cumulative cases. This is daily cases. And obviously there's a lot of variability in reporting, but you get a sense over time when you look at daily cases. So New Orleans is on panel on your left and Baton Rouge on your right. But you can see clearly New Orleans about a month ago, very low levels, probably less than 50 cases, large peak and spike around the beginning of April, and they have come down. And they have down to very few cases. Again, I showed you before how both their syndromic cases have come down as well as their actual number of cases. Next slide. This is Seattle. So you can see they had a much lower peak. And this is when we talk about flattening the curve. This is what flattening the curve looks like. It becomes a longer, slower decline, but it never gets very high and then goes back down. Next slide. And then this is Detroit. And we always look at the metros as a consolidated. So this is both Wayne and Oakland in Michigan. And we really want to thank the mayor for the incredible job that they have done to really ensure that everyone is receiving the adequate health care and testing. And they've done quite a good job with testing in Michigan. But all of these states, Louisiana and New York, have tested 30,000 per million inhabitants. Those are some of our highest numbers across the board. And next slide. And so the president talked about the case fatality rates, and we've lost a lot of Americans to this disease, and we pray and hope for each one of them that are in the hospitals and the excellent care. What this graph illustrates is the amazing work of the American people to really adhere to social distancing. This was nothing we had ever attempted to do as a nation, and the world hadn't attempted to do. But they were able to decrease the number of cases so that in general, most of the metro areas never had an issue of complete crisis care of all of their hospitals in a region. And so you can see our case fatality rate is about half to a third of many of the other countries.
Excuse me, does anybody really believe this number? Does anybody really believe this number?
I put China on there so you could see how basically unrealistic this could be. When highly developed healthcare delivery systems of the United Kingdom and France and Belgium and Italy and Spain with extraordinary doctors and nurses and equipment have case fatality rates in the 20s up to 45, and Belgium is extraordinarily competent healthcare delivery system, and then China at 0.33. You realize that these numbers, and this includes the doubled number out of Wuhan. And so I want it really to put it in perspective, but I wanted you also to see how great the care has been for every American that has been hospitalized. And the extraordinary work of our doctors and nurses and our laboratorians on the front line who have been doing an excellent job. Next slide. And then we also wanted to show...
Also the number for Iran. Does anybody really believe that when you see what's going on over there? Does anybody, you put that slide back if you would. Does anybody believe this number? Does anybody believe this number? We saw more
and this is why
bags on television than that.
This is
Jeff?
Mr. President, you've mentioned, and the doctor mentioned China a few times today, that clearly suggesting that the data has not been good. And
Well, you tell me, do you think that data is good when you see that? Do you think that's correct, okay? Do you honestly believe that's correct?
pretty dramatic contrast. So my question for
Dramatic?
you,
Yeah, I'd say it's dramatic.
so my question for you, sir, is
Why didn't the press, why didn't you people figure that out though? Why do we have to put up a chart? The number's impossible, it's an impossible number to hit. But why haven't you come up and said that?
the question, sir, is China now cooperating with the United States to figure out what happened, and what do you want from them now?
Well, they said they're doing an investigation, that they're doing an investigation. So let's see what happens with their investigation, but we're doing investigations also. Yeah, go, and so I just don't think you were listening.
Senators were complaining to
Which senators?
To Vice President
Which
Pence
senators?
yesterday.
Which senators?
Independent Senator Angus King.
He's not an independent, okay? Angus King is worse than any Democrat. Go ahead.
But he said that he was livid, actually.
Of course he said that, because he's a Democrat, okay? Angus King is not an independent. He uses that term for whatever reason. It's a waste of time.
But he's not a very emotive type
Oh,
of
yes,
senator.
he is. You haven't seen him. Okay, you haven't seen him. No. Angus King is a Democrat, and that was totally staged. I heard that, and it was totally staged. Just like you read the question, he read his question. So we're trying to get 250. Nancy Pelosi is blocking it. She sits in her house in San Francisco, overlooking the ocean, and she doesn't want to come back. She doesn't want to come back. She doesn't want to come back to D.C. She's got to get back and get this thing approved. It's very important. Getting along very nicely with the governor of Michigan, but she has things, don't buy paint, don't buy roses, don't buy, I mean, she's got all these crazy things. I really believe somebody sitting in their boat in a lake should be okay. They shouldn't arrest people. Some of them are being unreasonable. I really believe that. They're being unreasonable. A deal if it wasn't for John Kerry. But he doesn't want to be, number one, embarrassed. Number two, he said, let's wait till after the election. Maybe Sleepy Joe Biden's going to win. And if Sleepy Joe Biden wins, you'll own the United States. And China will own the United States. China's paid us, you know, from the Wall Street Journal, hundreds of billions of dollars. Is that right, tariffs? And we gave a lot of that money, a small percentage, but a lot of money to the farmers. And it kept the farmers going great. Right? But hundreds, we're getting tens of billions of dollars in tariffs. And by the way, for those of you that say, oh, we're paying, China devalued their currency in order to pay these. We didn't pay. China paid. They don't like to write that. They also added money into their system, so they paid for that. No, I think you have numerous countries waiting to see whether or not Sleepy Joe wins, because if Sleepy Joe won, they own our country. They will take our country. You know, we had, go back 2 months, we had by far And China was supposed to catch us. You know better than anybody, Wall Street Journal. For years I've heard, by 2019, China will catch us. There's only one problem. Trump got elected in 2016. That was a big difference. And we were going leaps and bounds above China. And before the problem with the plague, right? China was having the worst year they've had in 67 years. That was before the plague. Now they're getting really hurt, and so is everybody getting hurt. I don't want them to get hurt, but they're all getting hurt. Everybody's getting hurt. It's a horrible thing that's happened. But we had the greatest economy in the world by far. China isn't even close. Go back 2 months. And we're going to keep it that way. But when you mention Iran, Iran is a much different country than it was. When I first came in, Iran was going to take over the entire Middle East. Right now, they just want to survive. They're having protests every week. They're loaded up with the plague, which I don't want. I've offered to help them if they want. If they need ventilators, which they do, I would send them ventilators. We have thousands of excess ventilators coming in. And here, we have a stockpile of ventilators, and we're starting to send them so that hospitals can fill up their stockpile, which they should have. New York had a chance to get 16,000 ventilators, and they chose not to do it, and I understand that. It's a hard decision for a thing that may or may not happen. I fully understand that. I'm not even complaining about that. I'm only saying this. Iran was a terror when I came into office. Right now, they don't want to mess around with us. They don't want to mess around with us. Two things. North Korea, same sanctions we've always had, except more. We haven't given anything. I think you'll hopefully take that back to the Wall Street Journal because they really don't understand it. They really don't. And with Iran, I mean, that's a different country right now. And they want to make a deal. The only reason they don't, they're being shamed in because the guy that gave them the sweetheart didn't want to met with them many times. He should have never met with them. And in my opinion, he's telling them, don't wait. Maybe Trump will lose, and then you can negotiate with a patsy, with a weak guy, and you'll take over between you and Russia. Nobody's been tougher on Putin. He knows it better than anybody. Nobody's been tougher on Putin than me. Look at the sanctions. Look at what I did with their pipeline going into Europe. Nobody even knew about it. I exposed it. Now everybody talks about it. I think it's a terrible thing for Germany to do. But at the same time, I have a very good relationship with Putin, and I was able to make a deal with Russia and Saudi Arabia and OPEC Plus. They call it OPEC Plus. That's going to save us, Texas, North Dakota, Oklahoma, other states, energy states, going to save us hundreds of thousands of jobs. And in fact, your paper wrote an incredible editorial for a change that Trump made a great deal for our country. That was a nice thing. I was shocked to see it coming out of the Wall Street Journal. Thank you all very much. We'll see you tomorrow. Thank you. Thank you very much.